Grew up in a family of physicians. My dad's a pediatrician. He's practiced in Hamilton, New Jersey, not too far from here, still practicing. Hardest working guy I think I've ever met. My mom's a psychiatrist, also still practicing here in Princeton, New Jersey. Despite long hours, challenging cases, both as a pediatrician and as a psychiatrist, just their love for what they did, those sort of things, even as like a young kid, without understanding the medical part of it, just rubbed off on me, and I think was one of the main reasons I went down the same path. Hello, I'm Anish Sheth. I'm a gastroenterologist here at Penn Medicine. What I love the most about gastroenterology is two things. Number one, it's the breadth of organ systems we deal with. So I tell patients we deal with everything from swallowing, the esophagus, all the way down to the intestines, including the pancreas, the liver, the gallbladder. But also the second thing is that we do procedures and we see patients in the office. I wanted to be able to see somebody in the office, talk to them, really understand what's going on, and then if needed, be able to do a procedure to help fix what's going on. I have a particular area of focus in the esophagus, so I did some advanced training when I was in fellowship. Patients who have trouble swallowing, patients who have acid reflux and complications of acid reflux, specifically something called Barrett's esophagus. The large amount of things, again, that we do in gastroenterology, it's nice to also have that niche there to sort of be the expert here locally when somebody has a complex esophageal issue. Most of the things I'm going to see as an expert, sort of subspecialty type thing, have to do with esophageal disorders. Really, the first step is having a good office consultation, understanding when is this happening? Is it happening with liquids? Is it happening with solid foods? How long has it been going on? Because we have the expertise and the technology now to diagnose these various conditions, we can sort of narrow things down, explain to the patient, well, we're going to start here. Depending on what this shows, we're going to go to the next level till we get them to the point where we come up with a treatment plan. What we have recently understood is the relationship between the brain and the gut. Here at Penn Medicine Princeton, we actually offer something called cognitive behavioral therapy. So we take care of a lot of the gastrointestinal symptoms and complaints, but we can also then give a direct handoff to our psychology colleagues who are trained in what we call gut-specific cognitive behavioral therapy. And I think it's one of the elements of gastroenterology that is really at the forefront now, is we've known a lot of things about the gut for a long time, but we're really scratching the surface on how can we better impact patients' health by focusing not on just the gut, but also on the brain-gut interaction. Best part of my job, I would say the people I work with and the patients that I take care of. I think, we're in a field where people are very appreciative when you do make them feel better. I also love working where I work. You get the ability to work with various teams, collaboration with surgeons and nutritionists and psychologists. They want to innovate, they want to learn, they want to push things forward to the next level. And I think that environment, makes us all better. And I think in the end, patients will benefit.